Do you know what is trauma coding? If you know the answer, please mention in the comment section. Do you know what is regular ER coding? If you know the answer, please mention in the comment section. If you don't know both of these, no need to worry. We will learn trauma coding versus regular ER coding. First, what is trauma coding? Trauma coding is the coding where we will code for more severe conditions. Whereas in regular ER coding, we will code for small incisions like laceration repairs, foreign body removals, all those. These procedures will not be a problem for the patients if you do lately. Trauma coding and regular ER coding divides into 5 types of criteria. First, what is the difference between trauma coding versus regular ER coding for patient's condition? In trauma coding, most of the time, patient will be in severe trauma or an injury. Whereas in regular ED coding, patient will come with general illness as well as minor surgery or minor injury like we have learned laceration repairs, foreign body removals, all those things. So what is most important in the concept? If the patient came in for severe trauma or injury, it will comes under trauma coding. If the patient came in with general illness or minor injury, we need to code from ER coding. Next, we need to understand who will be involved in trauma coding as well as ER coding. In trauma coding team will be involved or trauma team will be involved. In ER coding, ER team will be involved like ER physicians involved in the ER coding or ER team. Where do we get the documentation in order to code trauma coding and ER coding? For trauma coding, we need to consider documentation from trauma charts as well as critical care. Whereas for ER coding, we need to consider documentation from ER notes. So what are the codes used in trauma coding and ER coding? In trauma coding, we will use G0390, 992912, 99292 as well as for acid-intensium diagnosis, we need to use injury codes. Whereas in ER coding, as all of us know, we will use 992812, 99285 along with diagnosis codes. In building prospective, trauma coding needs complex services as well as resources. So trauma coding is having the high billing for cases, whereas ER coding is having low to moderate resources. While use 992912, 99292, we will use 99291 for 30 to 74 minutes of critical care, while 99292 is for each additional 30 minutes, then 74 minutes or after 74 minutes or beyond 74 minutes. And revenue code wise, we will use 06812, 08689 for trauma coding. While coding trauma coding, we need to use one HCPCS code which is G0390, which we need to use along with critical care codes which are 992912, 99292. So thank you members. So if anyone looking for same day surgery coding training, IPDRG training, SEC training, CE certification training, please contact 707-526-3939 for immediate action. If you like this session, please click on like button in order to create more videos like this.